Cole Holcomb of the Pittsburgh Steelers suffered a bad knee injury tonight where he actually needed to be carted off of the field. The injury was bad enough where they did not show a replay. However, there's a clip circulating on social media that just shows that affected knee go into a lot of hyperextension. With today's video, we're going to go over the relevant anatomy that's at risk when the knee goes into hyperextension and some structures that can be affected. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. And with my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I also go over the relevant anatomy of the injury as well as what that person should expect when in rehab. If you like this content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you yourself have a personal experience with the injury being featured, go ahead and comment on the section below. Now we can see here that as Holcomb is running across the field, his teammate is actually going to fall, and while this is happening, his leg comes across and it's going to hit Holcomb's left knee and put it in a lot of hyperextension. So here I have a model of the knee joint, and so the knee is formed by that thigh bone, also known as the femur, that's going to come down and form the top portion of the knee. Then on the bottom here, we have the tibia, also known as the shin bone, that's going to come up and form the bottom portion. And as we move laterally or towards the outside portion here, you have the fibula bone as well. There are four main ligaments that contribute to overall knee stability. The first one being the ACL, also known as the anterior cruciate ligament, located right in through here. As we flip the model towards the inside or medial portion, we have the MCL or the medial collateral ligament. As we flip the model towards the outside here or the lateral portion, we have the LCL, also known as the lateral collateral ligament. And finally, as we move towards the back, we have the PCL, also known as the posterior cruciate ligament. Also, there are two other structures that are located within the knee joint itself. And basically, these are pieces of fiber cartilage that are going to act as shock absorbers between the femur and tibia, and they are, of course, the medial and lateral meniscus. There are two main motions at the knee. The first one is being flexion, where that knee is going to bend like this. So basically, a person is going to have as much flexion that their soft tissue is going to allow. Usually, it's anywhere from 120 to about 140 degrees. Then the opposite of that is going to be extension, also known as straightening of the knee. Usually the norm value for this is about 0 degrees. However, there are a lot of people that have just natural hyperextension at the knee. So as we look at the replay again, we see here that as his teammate actually hits his knee accidentally, that causes his left knee to go into a lot of hyperextension. And this is actually an extremely risky position for the knee. If you look at the model here, as I go through hyperextension, that essentially is stretching and stressing all of those effective ligaments that are contributing to knee stability. So this is something that's very concerning for a number of reasons. This position can lead to ligament tears, whether it be a single or multi-ligament injury. One other thing to think about in the actual mechanism of this injury here is the involvement of the posterior cruciate ligament, or the PCL, because that is actually going to check posterior translation of the tibia. So when we see in the video here that as his teammate actually makes contact, that's driving that tibia backwards, and that can absolutely stress that PCL. A lot of times when people injure the PCL, they're going to be driving where essentially that tibia is going to hit the dashboard and drive the tibia backwards. Other times where a person is going to fall directly onto the knee and also drive the tibia backwards. So that's something that's also definitely at risk for this video here. There are some on-the-field tests or in the clinic tests that can be done to determine what exactly is going on in terms of the injury here. The first one is known as a valgus test. So essentially what they're going to do is provide a lateral to medial force, and that's going to stress the MCL. The opposite of that is a varus force, where they're going from the medial to lateral portion. That's going to stress the LCL. There's a test known as the Lockman's test, where they're going to essentially pull that tibia forward. And the opposite of that is known as the posterior drawer, where they're going to be pushing that tibia backwards. Basically, what you're going to do with these tests is you're going to do it on the affected knee. You're going to compare it to the non-affected knee. And essentially, if the person is reproducing pain or they're also reproducing laxity compared to their side, that makes us think that that ligament is involved in the injury. The gold standard, of course, to determine the severity is going to be the MRI, and that brings us into the grading system. So anytime there's a potential ligament injury, there is a grading system of grades 1, 2, and 3. In a grade 1, this is where you're getting stretching of the affected ligament. In a grade 2, you're getting partial tearing. And finally, in a grade 3, this is where you're getting a full rupture. Not all knee hyperextension injuries lead to full ruptures of the ligament, so it's very important to say that. However, the injury was severe enough where, once again, they did not re-show the replay, and it required required him to be carted off of the field. So we're going to need to wait and see essentially what that MRI is going to show in terms of the severity before we can determine how long he's going to be out. If I happen to hear any updates regarding Cole Holcomb's case, I'll be sure to update everybody in the comment section. Also, if you happen to hear anything, please feel free to update me as well. So we wish him the best of luck moving forward. The knee hyperextension, once again, is a very compromising position. We hope it's along the lines of more of one of those low-grade sprains, but the MRI is going to tell all. Once again, thank you so much for tuning into my channel today. If you enjoy this sort of content, I'm going to go ahead and link another one of my playlists so that you can watch some of the injuries that I've talked about in the past. Thanks again for tuning in, and I'll see you next time.